Hi, everybody. It's Dr. Linda of the Vascular Birthmarks Foundation. Now, just hold on so I can check and make sure that we are visible and live. There we are. I see us on the laptop. I just got to see us together on here so I know that it is working. Oops. Sorry, I'm not seeing it yet. Let me just try here. This is always one of the things we have to do is make sure we're on here. Oh, there we are. Vascular birthmarks. Let's see some of your little bubbles, and if you see us, just show us that you do see us. Why am I not seeing it on the phone? Hold up. Oh yeah, it's saying we're live. There we are. Yay! There we are. Welcome, Dr. Gregory Levitin, VBF expert on infantile hemangiomas and port wine stain birthmarks. We're coming live for April 2024 from New York City. Thank you for agreeing to be here.
My pleasure.
And can you believe it's our 30th anniversary this year?
And that aging us.
Yes, and that means because I think I met you in 04,
yep.
So that would be 20 years ago. Woo! So Dr. Levitin is here to take your questions. I can see us live. I don't see any.
There's some people.
Yeah, I see.
Right there.
But I'm. Oh, hi! But it's not showing up on here. Oh, good. See it because I got to see it on here.
Oh, yeah.
Hi, Florence. Hi, Seema. Hi, Gina. Gina saying hi. Hi, Carrie, and 4 others. Hello from Charlotte, North Carolina. Dr. Levitin and I will be wrapping at 4:50, 10 minutes early. So we logged on early, so you can just start asking your questions right away. We have 13 on, so it's populating, and it's 4 o'clock just now. So go ahead and ask your questions. Hi, Dennis. He's Dennis Fiorino. Hi, Dr. Levitin.
Yeah.
And I'm sure some of these other ones you probably know. Sarah, hi from Scotland. We are more than happy to answer your questions. Why is Canada, British Columbia so far behind the USA?
Well, Canada has socialized medicine, and so private clinics seem to be where the cutting edge of medicine and laser and treatment is. But unfortunately, technology as it ages becomes widely disseminated. So hopefully there'll be some specialty clinics in Canada that can cater to this. I know Toronto has one, but again, because of their system being slow, we encourage a lot of people to look to south to the United States because there's a lot of clinics in the United States that cater to Canadian patients, self-pay discounts, just to ensure that these babies get the care that they need.
Thank you for that. Hi, Jen from New Zealand. Also, we do have a really rapidly growing progressive group out of Alberta, Canada, with that Nurse Humphreys and Dr. Remington.
Yeah, Remington, sure.
And they are
they're
very progressive with lasers. So if you can get to Alberta, I'm not very good with Canadian, British Columbian geography, but if you can get to Alberta, yeah. Hi, Kathy. She's a 64-year-old with a port wine. The last 15 years, her lip has gotten twice as big on one side. Can laser help or only surgery?
So what you're describing is called port wine stain hypertrophy, and about 15 to 20% of these cases happen over a lifetime. Sometimes it's stimulated by adolescent puberty with hormones, sometimes by pregnancy, sometimes by later in life. It just progressively happens. What you're describing is the unequal or asymmetric enlargement of the involved area of the lips from the port wine stain, which is very common. And the good news is surgery can actually restore this back to normal, so we get the same shape and size and symmetry to the lip. So I would encourage you to reach out to me after this on email, attach a photo, and I'd be glad to offer you some further advice.
Thank you. And Gina is on from the VBF, and she can post Dr. Levitin's email if you want to give a shout out to which one you prefer.
Dr. Levitin at birthmarkedcare.com.
Okay, good. Hi, Kathy. We already said hi from Tennessee, Lauren. So I hope that answered your question, Kathy. We can do more.
Yep.
I'm going to be posting tomorrow Dr. Geronimus's latest study in JAMA on weekly treatments for newborns.
Really?
And has complete clearance by 2 months.
We are breaking records every day.
We are breaking records.
That's great.
I'm very excited. So once again, your questions. Oh, okay. So curious about any advances in port wine My son is characterized by his dermatologist as resistant. Tried
Alexandrite, yeah.
Yeah, tried it.
Two types of,
Yeah, curious if anything new on the horizon.
So this is, all shapes and sizes. Port wine, there's not one type of port wine stain. Some of them are a little deeper or darker than others. You described two types of laser treatments. One slightly more superficial, Alexandrite a little bit deeper, which is indicated for resistant port wine stains. Sometimes these are more resistant on extremities, and the torso and the face is less resistant. I'd love to see photos. That's kind of the best way to individualize treatment and plans by just, again, understanding exactly where this is and how this is manifest. It sounds also, sometimes you have to change the settings of a laser to get a better result than before. So you certainly want to try to find out what the settings were from the previous treatments. And certainly if it's not working, you got to change something. So again, I'm happy to offer you advice on your laser settings. Happy to look at your photos online. If you send me some photos, then we can talk.
Thank you for that. Dr. Geronimus was just saying that, like all the parents bring their settings with them from doctor to doctor, but you can't do that because with each treatment, the stain changes and the lasers and the user, so there's so many variables.
Well, the variables are all about safety, and it's like baking cookies. You may bake at 350, I may bake at 375, and then sometimes it takes just that little bit of difference to kind of hasten the recovery or hasten the clearance, so it's worth comparing apples to apples to see where the settings are. And it's not that one is better than the other, but sometimes after you get diminished results, you need to change something to see a different result.
Good point. Carrie says her grandson has a venous malformation that was diagnosed at Duke at six months ago. At this point, I'm not sure how old he is. At this point, they are not suggesting treatment, but it's very close to the eye. My husband and I are both in healthcare, and we are concerned.
All right, so you're describing a venous malformation is a type of vascular malformation with dilated veins that can be anywhere from the superficial part of the skin all the way deep into the muscle of the face or any other part of the body. And again, the best way to see where this is to do an MRI with and without contrast, and I assume if it's around the eye, someone has done that. Now, the real question is what needs to be done? Well, first of all, you want to ask, are there any functional deficits? Is the vision threatened or anything like that? The good news is that in the last decade, we have a lot more experience using bleomycin for injections around sensitive areas such as nerves and organs where you can get the sclerotherapy benefits but without the risk of any nerve injury, and at least extremely small at that risk. You need to be involved with a great interventional radiologist, and I think there's one at Duke and there's one at University of North Carolina, Chapel Hill. There's definitely one north and south of you as well, but we can certainly, again, happy to look over your photos, happy to kind of guide your treatment and help you find the right place for this, depending upon. And again, laser may be also very effective around the eye, especially if it's on the lining of the inside of the eye or on the skin on the outside. That can actually be safer than sclerotherapy. There's not one size that fits all. So again, please reach out to me. I'm happy to offer more specific advice to your child.
And he's 2.5 years old. She just texted that back.
Great time to look into this.
So she said, thank you. Dr. Eichenfield has tried for years, and Dr. Nelson tried another way. There's new lasers coming out to everybody. Candela's getting ready to launch a new laser that's got a bigger spot size, hopefully deeper. Every day things are changing, so don't lose hope. Sarah says, do you know about the RASA1 gene? Myself and 3 sons have this mutation and can't find much information. I have a brain AVM coiled with small bleed. After I'm worried I now have an AVM on my leg, would I be best to go to vascular?
Well, I would say is we are in April, and this October is the Vascular Birthmark Foundation's 30th anniversary, but more importantly is its annual clinic. And that clinic brings together experts from all types of genetics and vascular surgery, interventional radiology, and laser. And that's the kind of thing where you can bring all your studies, your MRIs on CDs, bring yourself and your family for a free night stay in New York. But more importantly is you can be front and center, in person, live with experts. And you've asked a question that deserves a very good answer that's probably beyond what we can do today, but I would encourage you, if you are able to travel, to come to New York in October, and that you can sign up on the birthmarked.org website for that conference.
And also, for our very first time this year, and I didn't get a chance to even tell you about this, Dr. Levitin, but we have now a free annual duplex ultrasound screening event in Greenwich, Connecticut, with Dr. Naeem Nasseri, who trained with Dr. Rosen. and he's both vascular and interventional, and he's got this new duplex, so we're going to be offering that as well.
Lower extremity duplexes?
It's head and neck and extremity. He
Great.
focuses on the below the head, obviously, but he is doing the duplex for assessment purposes from head to toe. So again, birthmarked.org, and you'll see all our free events: Italy, Connecticut, DC, and New York. And New York, as Dr. Levitin said, is the most important one. Okay. Jenny says she just turned 50, has a port rind on her eyelid and forehead, have never had treatment or any evaluations. I have had migraines on that side of my head most of my life. I live in Oklahoma and have often wondered if migraines are associated.
So that's a can of worms question. What I say is maybe, and by maybe is you have to kind of do the studies. Sturge-Weber syndrome is associated with V1 distribution, which is, again, the top of the forehead and the upper eyelids with port wine stains, meaning that it can go deeper into the lining of the brain as well. An MRI evaluation with a neurologist, or we have also our own specialist, Dr. Ann Comey, who often treats mostly children, but these children grow up to be adults, and she follows them for lifelong conditions. I would highly encourage you to reach out to her. She has guidelines and recommendations for your local doctors to order the right tests. There is also online communities that Dr. Comey moderates that can also give you great information. But more importantly for today's discussion, yes, there's laser for this. Port wine stains on the upper forehead and eyelids is thin skin, which is the best kind of skin to treat for pulse dye laser. Pulse dye laser is the treatment of choice for port wine stains initially to try to lighten them. They tend to be progressive, which means over time they get darker. But the more you treat them, the more you're able to reverse those changes. And I'd say that most dermatologists in this day and age have access to pulse dye lasers. There are also regional centers that in your surrounding area of the Southwest that can certainly help. If you have to travel a few hours, it's not too inconvenient to get treatment. But again, there's also a Find a Doctor link on the birthmarked.org website to help you find other specialists. And I'm always happy to look at your photos and offer advice. I have people that travel to me just for laser and enjoy a weekend in New York at the same time. So.
And don't forget, we have all our free laser clinics on our website.
And if you come to the conference, you can get not only a free visit, but also a free laser treatment at the same time in October.
So Alexander, he's from Georgia, the country, and he wanted to know if we've heard anything about the Advatix, ADVATX laser. A doctor in Turkey is proposing to try it on her 1-month-old. We've already done 15 treatments. Wow, good for you, but it's very resistant. I'm interested in if it's normal to use a 10 joule or 11 joule with 7 millimeter spot. I mean, it's so hard to make. Well, you'll answer.
Yeah.
The doctor in Turkey used those parameters. Unfortunately, the laser was out of dye, and we had to travel to different destinations. She said she could send you pictures and parameters.
Yep, I'd be happy to review that. Those are all reasonable settings. You can go a little higher for certain areas, than 10 or 11 joules, but 7 millimeter spot size is my preferred spot size as well. You wrote down Advatix. That's a trade name. If you could send me a link to that laser, that way I would at least be able to look it up online and tell you what the technology is. Every laser has its own specifications, its depth of penetration, and where it gets absorbed. But again, I would not just use any laser on a vascular birthmark. Certain lasers are preferred. Certain lasers can cause scarring, so you just want to be careful about that. And again, if you could reach out to me on email, patients email me from all over the world. You don't have to come all the way to New York just for my opinion. I'm happy to give you some advice and at least give you some confidence in knowing whether this is the right thing to do.
And also, Alexander, we do have the free diagnostic and laser and Sturge-Weber eval clinic coming up in Milan, Italy, with Dr. Coletti on June 7th, and that's not that far for them from Turkey.
Yep.
Because they said they would, having the visa problem, and that's in June.
Well, that's EU travel. That should be much easier.
And they get free laser.
There you go.
So next one is SB Cook. Hi, SB Cook. My 12-year-old has a macular edema in her right eye. She had both a port wine stain and PTO in her eye. It will not heal, and her vision is distorted and blurry. She's been on propranolol, but it hasn't worked. Now they are suggesting surgery to remove the fluid next week or radiation. Chance, you've seen this in this disease, and what is suggested treatment?
Wow. So that's a 12-year-old, and so you've crossed into a very specific, niche area of ophthalmology, and specifically the macular part, which is a retinal specialist. I'm going to have to defer to your pediatric ophthalmologist. This is something that they would see much more often than we would see. I don't think that propranolol at age 12 is likely to improve that. There are other types of medications, ophthalmologic injections that I would defer to your ophthalmologist for. I think it's always wise to get more than one opinion when there's like a question about these type of treatments and whether or not something is not going well. It's not to say again that there's one right or one wrong answer, but sometimes the best answer may be something, putting more than one head together. And that doesn't sound like an easy decision, so I really encourage you to get more than one opinion.
Also, Dr. Comey says it can be various eye conditions, and she said there was a port wine around the eye.
Yep.
So they should get an evaluation for Sturge-Weber, because it doesn't
Right.
just have to be glaucoma. It can
Well,
be
again, the
other
MRI
issues.
with or without contrast of the orbits, again,
Right.
I think they would take the lead of the ophthalmologist. That would be part of their standard workup to see what's going on behind there. And you can certainly see where things light up if it's vascular anomaly related.
Oh, so she just said autocorrect. It's nevus of Oda.
Oh.
That's a whole different thing. Yeah.
All right, so nevus of Oda is a pigmentary change, but it's certainly not something that is associated with any vascular change. But if you have macular deposition of this, that may be taking or displacing and causing some changes. This is absolutely an ophthalmologic issue that I'm going to hand off to your ophthalmologist.
Thank you. And hello, Bonowitz family. Hi, Taylor. Hi, Madison. Hi, Hamster. And hi, Banksy. Our cute little Bonowitz family.
Sure.
So Natalie Gitteritz, hello. I have a 6-month-old with a port wine on her right side of her face. We just started doing laser treatment.
Well, congratulations. You're getting started early. Obviously, how early? As early as you can. And 6 months is absolutely in that first year of life. And that's where we see the biggest difference when we can do our laser treatments in that early stage. I would encourage you to work closely with a pediatric dermatologist, help them work with you to get in as many treatments as you can as a young infant. Hopefully this is something that you're seeing improvements already with. Again, settings sometimes have to be adjusted for pediatric skin. And if you have any questions about the settings or if you want to share any photos, I'm happy to offer my advice, or after a few treatments, give a before and after photo so you can kind of see for yourself that you're seeing improvements, and that should encourage you to continue on. We tend to do as many treatments as we can in the first 2 years of life because that's where we see that big jump of where we can get clearance, help these children through socialization, through early childhood and school-age children, and hopefully, like I said, if you see signs of changes, you just add a few more lasers, and that hopefully keeps it stable. Hopefully it clears and looks good for their childhood age.
And a reminder for everyone that's on, Dr. Levitin will be one of our experts at our free consultation and laser clinic in October in New York City. You can bring all your records with you, and he'll be seeing everybody along with Dr. Coletti. Sandra says her daughter is 18-month-old and has a lymphovenous malformation under her tongue and on floor of mouth. Laser has never been discussed as an option. Currently, she received no treatment as she's doing really well and has only had one flare-up, which resulted in a feeding tube for 5 months when she was 6 months old. Her swelling went down on her tongue since, and she's doing great.
So on one hand, you're doing great. That's the good news. These are things that can flare up with any signs of systemic infection, and unfortunately, a lot of children have a lot of childhood viruses and infections and hanging around other children. And you're going to have to be very in touch with your pediatrician, who will be ready to treat these with both steroids and antibiotics for any flare-ups. Those can shorten the length of illness that causes the swelling. You already had a feeding tube once. And then you need an MRI with and without contrast. See the full extent of this. See where it is. There are roles for sclerotherapy early on, because if you treat the floor of the mouth early, you don't want anything to displace the growth of the mandible. Those can cause bony changes that have to be fixed later on. So I think it's important to work with a close team of craniofacial and vascular anomaly specialists to kind of guide you through that treatment.
Excellent. Seema says, my 6-month-old son was diagnosed with a port wine affecting his right scalp, face, and ear. We're based in London. He has had 5 PDL. Congratulations for having that in the UK with a 6-month-old. That's progressive. Using the Perfecta, which is good. First 4 treatments were at settings, the 595, 9.25 joule, 1.5 millisecond, 10 millimeter probe, 93 pulses. His right cheek has been resistant and the settings were changed. 7.5, you can see well. Question, with the laser settings, we haven't noticed a significant difference. We would be grateful if you had any further suggestions. And his skin looks constantly red and inflamed. Should we be doing anything else, as it is tricky to tell if there's any difference? You know, we're seeing a lot of like eczema with some of these babies.
I was going to say, is if you're describing potentially that there's other skin changes like pediatric eczema, things like that. Be sure to look out for pediatric food allergies, especially if they're being breastfed, whatever the mom's eating, the child's eating. Everything from soy, milk to peanuts and shellfish can cause local skin reactions, and anything as simple as Aquaphor or hydrocortisone 0.5% can be very helpful. Regarding your settings, you're actually doing good settings. There's nothing wrong with these settings, but these are all 10 millimeter spot size. Sometimes you want to take a chance at doing 7 millimeter spot size at 11 or 12 joules, again 1.5 milliseconds. Something to discuss with your doctor. It's really not for me to tell your doctor what to do, but to say these are other settings that I use very comfortably in my office, especially if you're not seeing much difference on the 10 millimeter spot size. It's worth trying the 7 millimeter spot size to see if you can get a better result.
Thank you. The last question she had, which is one of Dr. Comey's favorites, is that they unfortunately did an MRI with contrast at 11 weeks and reported it as normal, but Dr. Comey says you shouldn't have it done before age 1 because you can have a false negative.
She's right. What she's really describing is like if you do certain things too soon, you have to repeat them again. So again, she's been great about giving us guidelines that we all try to follow along. And I think, again, you do the test when you need to do the test. That might change your management. And if you can hold off a little bit longer, what she's saying is sometimes these things blossom or develop later. And so it's much, if you're going to put a child through a study, you want to make sure you get as much information as you can.
Right, and once again, you could see Dr. Comey at our conference for free in October, or in Italy, she'll be there as well. Samantha says, hi, Dr. Linda, Dr. Levitin. My son, almost 2, has Sturge-Weber and port wine on half his face, chest, down both arms and chest. He is often congested with runny nose and noisy breathing. We just went to an ENT and everything looked okay. I'm now concerned it may be vascular. Have you heard of this with facial port wine stain, and what would I have done next? What should I have done next to have this checked?
Scroll back up. How old is the child?
Almost 2.
Almost 2 with Sturge-Weber. So, Sturge-Weber by definition is, it penetrates, it goes deep, and all port wine stains can involve not just the superficial skin, but also the mucosal tissues and cause some enlargement as well. I think if you saw a pediatric ENT and they were able to do an endoscopy and scope and everything's fine, then I don't suspect there's any nasal obstruction from this. But I would also encourage you to use saline rinses, especially during the winter months when things can get dry. Saline drops for the infant nose is great because it's and also for us as well. The little bulb suction can kind of clear it out. You just want to make sure things are clear. You're describing difficulty breathing and whether or not this could be related to the port wine stain. It sounds like it's probably not if you had a good ENT examination.
Oh, thank you. Orlando made me laugh. He said, Dr. Orlando Alonso, at Dr. Levitin, can you come vacation in Costa Rica? I'm due for another treatment with you. I'm sure the TSA would let you travel with the pulse dye laser.
I'm sure they'll fit the overhead compartment and it'll be no problem.
Come on, Orlando. Come and see us at the conference in New York.
Yeah,
you get a free hotel.
And a free treatment.
And free ultrasound, definitive. Both Nevis, she has, the one who said Nevis Avota, she says she has both Nevis Avota and port wine.
Yep, well again, pediatric ophthalmology.
Right. Okay. Another one said, please come to Costa Rica. Maybe we should have a VBF.
Maybe that's our next conference.
Maybe that's where we do our conference. Why not? You guys work on that.
Especially
people
during the middle
from
of
Costa
January,
Rica.
February.
That's right. February is ideal.
Yeah.
Natalie said, I would like to ask about PDL treatment over the eyebrow. Should it be avoided? Also, any recommendations on how to mark the surrounding area around so the doctor knows where to treat?
So I didn't realize this was controversial, but a lot of people avoid hair-bearing skin. And I would say is that if you don't prepare the hair-bearing skin properly, then yes, the port wine, the freezing portion of the pulse-dye laser can break the hair and it breaks off. It grows back, but it just doesn't look good. I use a very thick aqua gel, water-based gel over this area, and I treat the hair-bearing areas, including the eyebrows, the scalp, and the sideburns, because if you avoid it, the benefits of the surrounding tissue, actually the contrast, I think, makes it stand out even more.
Agreed.
This is something that I've been doing for about 15 years comfortably, maybe it's close to 20 now. And so I think this is something that, those of us that do it this way see less than 10% loss of hair follicle density. So and you're not doing it every week, you're doing it like every 2 months, usually on the eyebrows. Sometimes you can do it maybe maximum 3 times a year just to be safe, because of the density. But again, whatever that 10%, it grows back. And I think that it's so important to treat because the part that gets left behind is just so glaringly obvious, and you've already done so much good work. I would encourage you, like every other treatment, to do the hair-bearing skin. That's my advice.
So, what are you using? What are you putting on it? Like Vaseline?
No. It has to be a gel. So any kind of aqua gel. It can be anything from an ultrasound gel to Surgigel. I use the stuff that we use in the OR. That's a generic aqua gel.
Good to know, though.
I mean, it's not rocket science. It's any kind of lubricating water-based gel. It just has to be thick. It has to be at least at least 3 or 4 millimeters thick. It's not a sheen. It has to be a glob, and you basically laser through the glob of aqua gel.
That makes sense because the laser seeks the hemoglobin.
Right, it penetrates. It's the coolness that you want to protect the hair follicles. So the hair follicles are essentially submerged in this gel.
Very smart. I like that. Lauren says, hello, my son is 18 months old and has tufted angioma in his left groin. We are currently on sirolimus, and luckily it has not affected his development. As far as I'm aware, surgery is sort of a last resort for KHA. Is that your understanding, or are there new and emerging techniques for KHA?
So, again, this is one of those very rare types of tumors. There's not one right answer. I need to see a photo, and I need to better understand what you're dealing with. Surgery is not our first choice, but it sometimes becomes a last choice, when there's something that's developmental or a risk of something like that. We do have treatments for this, including both, steroids and some of our, as you tried already, sirolimus. I think usually a good pediatric specialist for vascular anomalies, or someone that is, part of a team, because this usually requires more than one specialty to manage. And so I would encourage you to reach out to our team, and if you can, even come up in October so we can kind of help evaluate this. These are long-term management issues, and we're happy to help you with a little more details.
Thank you. Oh, Alexander circled back. He wants to know, what do you think about a 1.5 millisecond or even 3 millisecond pulse with a PDL? Is 3 milliseconds done by you in any circumstance? The doctor from Russia even told us that on the cheek she would do 3 milliseconds.
So the risk of doing the 3 milliseconds is scarring. You can burn the skin, and so my personal experience is limited to 1.5 milliseconds, sometimes 0.45 seconds, but only 3 millimeters is only used for hair removal because you're going to penetrate much deeper. And so I think you have to be really, really careful when you're talking about a vascular lesion for 3 milliseconds. So I would advise not.
Thank you. Madison Markowitz says, do you typically treat the eyelid with or without anesthesia? My son is almost 3 years old and has had 8 treatments, but only 2 on his eyelid. We haven't used anesthesia, and I'm nervous about trying to treat his eyelid at his age.
Yeah, so once they become cooperative, you can put numbing drops in the eye and add an eye shield. Anything that's on the eyelid has to be treated with an eye shield. And so again, you don't have to treat the eyelid every time, but you may want to consider 1 or 2 treatments a year under general anesthesia, where the child can be, given IV sedation or mask anesthesia, fall asleep, put an eye shield in, and then treat the eyelids that way. It's really, really hard to get a 3, 4, even 5 or 6 year old to cooperate to do that. It's more scary than anything. It's not that it hurts, because again, the numbing drops take away the pain, but it's an irritant, and so it's irritable, and they're even more irritable trying to hold them down to do that. So happy to talk to you offline about that, about strategies. Again, if he's tolerating the laser in the office, I would continue to do that. You can always treat the eyelid at a later time when you're comfortable.
Thank you. That's funny. Angelica's like, we would love to have you guys at Houston, Texas. Well, we have Dr. Paul Friedman there for laser, and Dr. Moishe Levy is at Dell Children's, and he has a pretty comprehensive vascular anomalies program if you're looking for somebody that is, really knowledgeable. Jen says, my daughter has a port wine on her face, under her eye. It was very light at birth, and it's getting darker over time. She's had 7 treatments under GA from age 1 till 4 years old. They usually do it every 3 months, but COVID stopped it. New Zealand system. It mostly stabilized, but sometimes lightens. It's been 2 years with no treatment, and it's darkened a lot. Could more consistent treatment, e.g. every 3 months, stop the progression?
Yes, great question. Adolescent growth is progressive, meaning that there's a lot of growth hormones involved, and that's when we see changes to port wine stains and other types of vascular malformations during hormonal changes, whether it be adolescent growth, pubescent growth, or pregnancy later in life. And I think those are the kind of things that you do 3 to 6 treatments in 1 year to get where you desire to be, and then as they grow, you do 2 or 3 treatments a year, ideally, to not only stabilize it, but even continue to improve it, meaning giving them breaks at a time so they're not constantly in the office for laser. But yes, absolutely. I always say, once it's stable and you're comfortable, you leave it alone, and then once it starts to darken, come back quickly for 1 or 2 treatments, and that can last another year or 2 or longer. But again, growing children means growing birthmarks.
Yep. Great. So you can talk about Dr. Coletti's technique to Andrea, who wants to know what's the future new idea for treating difficult AVMs in the ear.
Well, I don't want to steal Dr. Coletti's thunder. Dr. Coletti is our AVM specialist. He's on our website. He's the specialist in Milan. And he is really, like I said, at the cutting edge of what he's doing to manage these AVMs. What we really want to understand, first of all, is where's the AVM? What tissues does it involve? Is it stable? Like, is anything changing? If it's not growing, you actually want to leave it alone. These are, we choose not to treat AVMs that are stable, and we opt to treat AVMs that are showing signs of change or progression, because left alone, it may look mild now, but but you don't want to wait till it's severe or having bleeding episodes or anything like that. And again, with Dr. Coletti, with his sclerotherapy techniques and his latest techniques, we were, if you come to the conference, you're going to be able to see him give his talk and see his before and afters. And like I said, they are standalone procedures that we're not doing here in New York for sure. And I would encourage you to come meet Dr. Coletti and see if this is an option for you. And I'm happy to help guide you to that treatment if you want to reach out to me online.
And we're not sure where you're from, Andrea, but Dr. Coletti's got the free diagnostic clinic and laser clinic in Milan in June, and then he's here every October for our clinic.
Yep.
Orla says, my daughter is 14 months old, has hemangioma on her face between the upper lip and nose. She has been on propranolol, which has shown no change since 9 weeks. They are now querying whether this is a hemangioma at all. She is going for a biopsy in a few weeks. What would you advise? What could it be?
So not every hemangioma responds to propranolol, and if it does respond to propranolol, there are other types of pediatric vascular tumors. We heard about tufted angioma earlier. There's also non-involuting and rapidly involuting congenital hemangiomas, which are, again, vascular tumors. A picture tells the whole story, so I would encourage you to reach out to me through email. I'd be happy to evaluate your photos from 9 weeks to now if you can send me a few representative photos. I would say that it sounds like your doctors are doing the right thing. The most important thing is to get the diagnosis correct. But sometimes, again, I would do an MRI with and without contrast first, because you can often see the characteristics of the tumor without a biopsy if possible. But please share your information with me offline, and I'm happy to offer some further advice.
Yeah, and Seema circled back with another question with the child with the red cheeks, and she was saying how long should she, was talking about hydrocortisone cream.
Well, that's if you have pediatric eczema. And
right.
Again, your pediatric dermatologist should be guiding you through this.
Right.
I certainly can't. I'm offering you suggestions of if the diagnosis is correct, but I certainly defer to the doctor who's in front of you and who's treating you for these type of conditions. You can ask about these things.
Yep. And Angelica's asking for a workshop or a class. Well, we have our conference every year, and when you sign up, you get access to all the talks, because this year they won't be in person because we have the gala. Mm-hmm. But they'll all be online, and we have our online classes that are open to the public, the workshops. We have all of our Facebook Live videos. We have tons of stuff that you can access, and you can, again, reach out to Dr. Levitin to further discuss, because she's talking about the PIK3 mutation and that he may even have cloves.
Yep. And that's a syndrome that we have. We also have specialists on at the conference, so I can talk to you about that.
So Tracy says her son has a port wine over left eyelid, forehead, and extending up onto the top. He's 20 and has had 3 treatments at age 5 months, 9 months, and 11. He hasn't had anything else. I've noticed it's darkened, but still only dark red, not purple or raised. Is there a chance this could need more treatment as he ages? He was also diagnosed with glaucoma at 16. We live in Australia.
So the first thing I would say is he absolutely has to see a pediatric eye doctor every year. You just have to measure the glaucoma, make sure it's never progressing, if drops if necessary. Number 2, you're talking about the forehead and V1, V2, V3. He probably needs an MRI and evaluation with a neurologist, for Sturge-Weber syndrome, just to see if you have glaucoma. That's a very high probability. I don't know if he has any history of seizures at all, but again, neurologists will follow you for that. Regarding laser, a picture tells the whole story. Again, please share some photos. And yes, laser is absolutely indicated for visible facial port wine stains. If doing nothing, it allows it to progress. It just takes that much more laser later on in life to reverse those changes. And if he's comfortable with his laser, it's not that he has to treat it, but most people want to at least minimize these changes, prevent any progression or hypertrophy. And so it's very important at least to have that option presented to you.
Thank you for that. Tuesday Morning Star says her 1-year-old son has an extensive cavernous hemangioma on his right hand, the glove hemangioma. It covers most of the back of his hand and part of his wrist along his first 3 fingers and thumb and part of his palm. He's been on propranolol since 4 months. There is still a lot of color and swelling, though it has dramatically reduced it. His next review with pediatric derm keeps getting pushed back, now due in June.
Yeah.
I'm just wondering what sort of age you would recommend looking at laser as a further option.
So I would ask to see the photo because I think it's very important to get the diagnosis correct. When you use the word cavernous hemangioma, that's an older term that we used to lump a lot of birthmarks into. Sometimes these are different types of birthmarks called vascular malformations, venous malformations, or even something else. If it is a hemangioma, we can also make that diagnosis and call it an infantile hemangioma if that's correct. If it's deep, propranolol should have worked, but again, sometimes we see a lot of misdiagnosis. If it's a pediatric child or an infant, a lot of them get labeled as having hemangiomas because, of course, that's the most common tumor of infancy. But there are other, tumors, other vascular malformations. Very important to see a specialist. Or again, I'm happy to look at your photos online, which is what I do all the time, to make sure you get the correct diagnosis because all treatments, flows from getting the diagnosis correct.
And the way she spells color, she's from the UK, so
love it.
They use that a lot. Do you typically recommend treatment for CMTC, cutis marmorata?
Yeah.
Do you know of anyone using stem cell therapy or gene therapy for treatment?
Yeah, so that's a hard one. This is lymphatic malformation diagnosis called CMTC, where you have this marbled appearance of the legs. It's almost like it looks like the superficial veins have dilated in some way, shape, or form. I don't believe that anyone has a treatment that is highly effective for this, and then certainly, it would require often an extensive treatment to try to treat some of these areas. I'd be happy to talk to you if you can send me some photos and see if this is just a cutaneous or visual change. You can talk about doing compression therapy or any other types of non-invasive therapies, and so I'd be happy to talk to you more about that. It almost always requires, again, an evaluation with an MRI of the extremities, with or without contrast, to rule out any other associated malformations, deeper involvement. So I encourage you to, work with your pediatric specialist to, ensure you get the proper diagnosis first.
Thank you. Tracy said thank you, and she said her son does have an annual MRI on his brain.
Yep.
I don't know why annually, but it did pick up an aneurysm, but they don't think it's related to Sturge-Weber.
Well, again, you might, it's like taking your car to the mechanic. You go looking for a problem, you'll find some problems. I would say those are definitely things worth observing. If you can see 2 or 3 years in a row without change, most of them are doing MRIs every 2 to 5 years, depending upon the change in symptoms. So, again, Dr. Ann Comey is our specialist for Sturge-Weber. She's got great guidelines, to help people. She has online resources as well as a online community that she sends her newsletter out to. So please reach out to her to get onto her mailing list.
So we have around 10 minutes left, a little bit more than that, and we're pretty caught up. So if there's any of you that haven't asked your questions, because I see quite a few of you are still on, please ask your questions. Again, Dr. Levitin will be with us on October 4th at our gala, celebrating 30 years of VBF. and on the 5th at the free laser and consultation clinic. Friday we also have the free ultrasound and dental. So check us out at birthmarked.org. Florence says, can you please post the Edmonton, Alberta information so we can give them a call? Gina, if you have Barb Humphrey's email, could you please post it? She attends most of our conferences, and I do have it, Florence, so if somebody's not able to pull up her email for you, you can just email me at vbfpresident@gmail.com, and I'll do an introduction between you and Barb. So either way, we'll get it to you. And let's see, what else, Dr. Levitin, is new? New lasers will be coming out.
Yeah, you were just at the
ASLMS.
Yeah.
And one child in India had a stem cell transplant. The article's been circulating that has Sturge-Weber. It doesn't reverse it, but it kept any further seizures from happening.
Oh, for seizures. Well, that's, again, we were talking about this, Sturge-Weber represents, a spectrum of disease of port wine stains that penetrates into the lining of the brain. And again, pediatric seizures is often sometimes when something first shows up, and that can be very difficult to treat. And it sounds like there's some new and great things on the horizon, so that's exciting.
Yep, and the electrosclerotherapy, which Dr. Coletti is using, and the HIFU, the high intensity focused ultrasound. There's a study going on right now. Dr. Nasseri is participating where they're using this high intensity ultrasound to treat focal venous malformations without surgery. So it's a pilot study. So it kind of vibrates and shrinks it down with ultrasound technology. I'm excited to see that. Anything new, I'm open to. So we still have a few more minutes for some additional questions. So unless you don't have any more, we can wrap it up. But we typically go to like 10 of, but we do seem to be all caught up. So if there's no questions from anyone, I like to keep it going and not, any recommendations regarding do's and don'ts when marking the surrounding area of the port wine. It's interesting because we recommended the white stick for the parents to use a white eyeliner, but Dr. Geronimus was lasering and it fired, and he looked at the stick and it had formaldehyde. Yep. So what people are describing is sometimes you take a child into the operating room under general anesthesia, or even just in an office setting, and either the huffing and the puffing and the holding the breath, or when they go under anesthesia and the venous pressure changes, you can actually see fading away, or it's not always clear where the demarcation is. So we use actually a surgical marking pen about half a millimeter outside the edges. So you don't want to laser the pen, and you certainly don't want to laser something with formaldehyde because that can flare and cause an injury to the skin. But we mark out in the holding area with a surgical pen the outlines of the area, and sometimes I even take photos as well because I do a lot of my extensive lasers under general anesthesia. And it's very important because you can be very surprised at the changes when the child goes to sleep because the central venous pressure drops. And so these port wine stains, they dilate and they lose their vascular stain. It's actually like it happens right in front of you. It's quite amazing. And so having a good marking pen is very important before they go into the operating room because you just don't want to have missed the spot, so to speak. And it's important to treat the entire area if they're going to undergo a general anesthetic. Great question from Lauren. She wants to know what our super clinics are like. Well, you register at birthmarked.org. The only cost is a $25 hold on your card if you're seeking a free hotel. We offer free hotel. On Friday is free ultrasound, free dental for anyone with vascularity in the oral area, and a free Sturge-Weber evaluation with Dr. Comey, leading people in the world. That's on Friday. So ultrasound with Dr. Coletti to rule out anything deep or to confirm a diagnosis. Then Saturday, Dr. Levitin and 14 other world-renowned experts will be on 6 teams and will see patients every 15 minutes. And then is the free laser clinic. And we also have some fun things for the kids, but check it out. Go to birthmarked.org and look at it, and even look at some of our past conferences or clinics. As we come down the finish line, Parda, I did not, she said she posted her question 2 times. Can you not see it? I did not see it, Parda, so go ahead and post it again. And then Jen says her daughter has a hemangioma on her forehead that rapidly grew from 3 weeks till 5. At 5 weeks old, we saw a pederm, was prescribed timolol. There's been no growth since, but also no reduction. She is now 4 months. At this point, should we see any changes to the hemangioma?
So the right answer is laser, laser, laser. Forehead hemangioma is a very accessible area to do a quick pulse-eye laser. It requires 3 to 5 treatments in the first 3 to 5 months of life. You can do them every 3 or 4 weeks. Timolol is really not expected to do much, if anything, for this type of skin. Timolol, I see only a little bit of changes when it's on the eyelid or the nose or the tip of the nose or the ears where there's thin skin. But anything that has a slightly deeper thickness to it, whether it be the cheeks or the forehead, timolol just doesn't work. You could consider oral propranolol therapy if you were seeing increased growth, but you said it's stable right now, so I think it's a great window of opportunity to start pulse-eye laser. And again, if your doctor doesn't have that, they hopefully have an access or a referral to get you treated. And I'm happy, like I said, to be a resource here in New York if you have any questions.
Thank you. Parda, because we only have a couple minutes left, please submit it again.
It's right there. I can see it over here.
Oh, well, why is it not on here? Is there any medication to treat the GNAQ for port wine on an enlarged lip? No. No medication.
Yeah, that's the newest thing is precision medicine. We're starting to identify genetic mutations associated with vascular malformations. There are a couple new medications, one being Bejoice for the PIK3 mutation, and of course sirolimus has been around for several years. These are still in development. They are still working with patients on the in the first wave, if you will. I think there might be some talks this October about people who have more experience about that. I have very little experience about that. Because I tend to be mostly a laser and surgeon for this. But as far as enlarged lip, that's usually a surgical indication. Regarding whether or not vascular endothelial growth factor is I think that may be the causative nature of increased growth perhaps. But left alone, these typically progress and get worse. So please reach out to me online. I'm happy to look at your photos and offer further advice.
Then we also have a geneticist, Dr. Pappas, who comes to our conference every year, and he's on the team with the syndromes, like with Dr. Comey for Sturge-Weber and KTS and other syndromes. So once again, check that out at birthmarked.org. Natalie says Dr. Levitin looks like one of those doctors, transmits a lot of peace and trust with your heart. I love that. I would absolutely love to get an appointment with him at some point. Thank you so much for taking the time to answer our questions. My baby is 15 months old. He has a port wine on his forehead. Well, you see his email. It's right there. Send your baby's beautiful picture, and Dr. Levitin will be happy to discuss treatment options and with you.
Thank you. That's a nice
compliment. There's unfortunately there's no funding for anyone to attend, but we are the only foundation in the world that offers all these services for free, including a free hotel and free Sturge-Weber, and everything is ultrasound, thousands of dollars worth of free things that we offer. Okay, well, it is far, but again, we have New York and we have Milan, and you can get a lot of the same services at both. So think about those. Check it out on our website. Tremetinib, Parda, email me at vbfpresident@gmail.com, because I've been hearing about the tremetinib working on the hypertrophic lip, and I've been trying to find somebody who's been on it, because some of the doctors have been asking me if there's any patients. So I'd like to see some of those pictures. Seema, if my 6 months old cheek, 5 PDLs so far at 4 weeks, continues to be resistant, in your opinion, when do you decide to stop regularly 4 weekly cycles and move on?
Well, again, you have to change the settings, because again, when you get diminishing returns, you don't want to keep using the same settings. But if you can find the settings that make a difference, you should see like a staircase improvement every time. It's not like it goes away quickly, but you should see an improvement after every treatment after 3 or 4 weeks.
Final question. If a baby is very anxious and the baby is before age 2, will you use general anesthesia with the parents' consent?
So I use the size of the area to be the the biggest indicator of whether or not we choose to do it in the office or in the operating room. If it's a large area and the child's comfort and anxiety is of great concern, then yes, I do perform quick inhalational anesthesia for port wine stains and hemangiomas of large areas in the operating room. And we've had no problem with our insurance companies covering this, but we just, like I said, we try to use it only as for larger treated areas, and also for both patient safety if they're moving, if they're just anxious, and sometimes that's the safest way to do it.
What is the inhalation, like a gas?
Yeah, just
nitrous oxide.
Well, it's a mixture of nitrous oxide and sevoflurane,
Oh,
which
nice.
is again, it's what we do for kids who get ear tubes. Just put them asleep with a little mask for 5 minutes, and it's safe and easy. The kids bounce back very quickly. And like I said, it's not traumatic. I mean, they just take 5 or 6 deep breaths. They blow up the balloon, and then they're asleep before you know it.
Wow,
So,
that's awesome.
yeah, that's all it takes.
Thank you so much for being here. Thank you all for your questions. Anybody can re-watch this as many times as you want into infinity. Go to our Facebook page and re-watch it, or go to our birthmarked.org and click on the YouTube video icon. Oops, sorry. Sorry, I almost ended it before I was done speaking. And thank you again.
It's my pleasure. Great
And
to see
stay
everybody.
well and stay healthy. Next month in May, stay tuned for Dr. Roy Geronimus during our month of awareness, where we'll ask you all to put on your birthmark. Thank you.